Hello everyone, this is Professor Turpin. I'm going to run through several of these slides and try to talk to you about Chapter 47. First thing that your chapter reviews deals with eyelid disorders, and these are just a few. You can see the pictures that coincide with this on the right. These are things you want to kind of look for, particularly in hospitalized patients. Different things related to aging and infection can cause some of these conditions, but they are an abnormal finding. If you look at the second one, entropium, it's an inward turning of the lid, and it makes the lashes on that lower part actually like go inside and really rub against the eye, exterior part of the eyeball itself. And that does require some type of surgical intervention to correct. It can cause corneal abrasions that we're going to talk about as well. Ectropion is the outward turning of the lid, and it also requires a surgical correction, and you can see that on the bottom picture there. Other eyelid disorders are shown here. Many of you had a sty in your eye, so you are familiar with that particular problem. But you can see two examples of this in the upper two pictures here. One's an internal one, one's an external one. You can also have an inflammation of a sebaceous gland in the eye, chalazion, and while that may look like a sty in the beginning, the larger it gets, you begin to see that it's more than just a little simple sty that is causing problems. And, you may ask, well, what are the common approaches to care for eyelid disorders? A lot of times it's surgical interventions. It may be antibiotics to treat whatever's causing the issue. Often these styes, if they don't resolve on their own, require, lancing to kind of open them up and then treat them with antibiotics. But as you heard, many of them require surgical interventions. Other things that are also pretty oftenly done with a lot of eye abnormalities is ophthalmic ointments. And you can see, interestingly enough, this is a picture from our book. And, this is something that you would never do without gloves on. For the record, and most of y'all would know that already, but there is a right way to really put ointment like just along the lower lid, and then have the patient kind of blink their eyes several times to kind of really get it to absorb throughout over the whole eye and the upper and lower lids. Other things is really trying to watch and be careful about any kind of cross-contamination. So thus the person would do standard precautions, wear gloves while they're doing this procedure. Most of the time, ointments and drops remain in the patient's room just to keep that from being an issue for contamination of other patients or other coworkers. We'll talk about some different types of conjunctivitis, and this is one in particular, is Corrado conjunctivitis sicca, which is really a long name for dry eye syndrome. And anybody that watches TV has heard all about rosacea and chronic dry eye, and that's really what this is. It can be caused by changes in what the tear fluid is composed of. You can have the gland, your lacrimal gland, not functioning properly. Sometimes tear distribution is affected. And then there are drugs, of course, we know that tend to dry out body fluids in general, like antihistamines and anticholinergics that can create symptoms like this as well. Typical treatment is going to be with artificial tears or some type of lubricating ointment, and surgery can be done also sometimes to improve this situation. And as you've seen on TV, Restasis is now used. I did look up the cost of that drug, and it is very, very expensive because of the newness of it. So a lot of times for your elderly patients that do gradually get some of this dry eye syndrome, it may not be the drug of choice for them on a tight lifestyle budget. In terms of hemorrhage in the conjunctiva, These will show up from time to time for different reasons, but you may see a small, well-defined area of bright red hemorrhage under the conjunctiva, and it will just look really bright red, and it looks horrible, and the patient's looking in their eye thinking, what in the world have I done? But they may have no pain whatsoever. They may have no visual impairment. And as a general rule, these will most often resolve in a couple weeks without any treatment at all. And rarely, if that doesn't occur, I have seen physicians order maybe some anti-steroid drugs to hasten that a little bit, but generally they're just left to resolve on their own. Now, a lot of people have had conjunctivitis. It can be inflammatory or it can be due to infection. If it's just inflammatory alone, it's often due to an allergen. And interventions, if it's an allergic type reaction of inflammation, they may be put on vasoconstrictor and corticosteroid eye drops to kind of decrease the inflammation. Obviously in the picture it appears bacterial because of the purulent drainage. We'd want to culture that. They would be on some type of ophthalmic antibiotics, and strict hand washing, no sharing of washcloths or towels if they're putting warm compresses to their eye. A lot of patient teaching really about how to not contaminate your other eye, how to get rid of eye makeup if you're female, or contact lenses that you've been using up till this point need to be gotten rid of and not reused. And if you think about it from a healthcare worker standpoint, if we should get one of these, we really are not allowed to work. I'm not sure if you know that, but if you have this, you have to get really a clearance from a physician to be back caring for patients, because you can not only contaminate your patients that you're caring for, but you may be rubbing your eye, touching a doorknob, some other caregiver or worker you work with touches that, and then they contaminate somebody, as it's highly contagious often. So just know that there are a lot of specific things you want to educate your patient on related to that. Trachoma is a chronic bilateral scarring form of conjunctivitis, and it's caused by chlamydia. It's it is the chief cause of preventable types of blindness worldwide. You have follicles form on the eyelid that turn inward, and again, those lashes damage the cornea from being rolled up in there. It's treated with oral Zithromax, which is the most effective, or the patients can be put on 4 weeks of tetracycline. The same infection control things that you want to use in general that we just discussed. Other things that can happen, you can have disorders of the cornea, which is the outward layer of the eye. You can have abrasions, then that creates an ulceration. The ulceration opens up the tissue, then it's a portal for infection. And abrasions can be caused by the lashes, they could be caused by foreign body, they could be caused by contact lenses. And the way that this is really assessed is they use a specific type of stain that they put in your eye, and they use a blue light to look at, and I've included a YouTube for y'all to look at to see what that actually looks like in the eye firsthand. These are just some of the interventions. Of course, we would culture this. Sometimes they'll do scrapings of the cornea, antibiotics, antifungals, or antivirals, depending on what is the source of the infection. Sometimes drops have to be given very, very frequently, as much as every hour, maybe for the first 24 hours. And that takes some diligence with you and your family trying to make sure you stay awake and wake up and get that done. Again, making sure to not cross-contaminate between your eyes and not wearing contacts while this is going on. Other corneal disorders include one that deals with, it's called keratoconus, which is a degeneration that results in an abnormal shape in the eye. You can see pictures of this in this bottom right corner. The first eye is normal, and the second one has this cone shape of extension that comes out from it. The cornea is protruding out. And so the two main interventions that are done for this is a corneal ring implant that's done under local anesthetic, and is usually a fairly quick surgery, as well as a corneal transplant or keratoplasty. I can't speak today. Anyway, you get the picture. Pre-op, with that particular thing, you're going to instill antibiotics up till the time of surgery. They'll have to have an IV inserted just for precautions. Post-operative, they have to have a lot of extensive teaching because they're going to go home on local antibiotics that may have to be injected or instilled in the eye. They're going to wear a pressure patch and then an eye shield over that. And then the eye shield they'll have to wear for several weeks, and the patch may stay on as long as the physician gives them instructions related to that. You want to avoid and reduce intraocular pressure with this so that it doesn't bulge out again. The patients are told to lie on their non-operative side. They are to eliminate all the activities that would increase eye pressure, like jogging, running, dancing, any heavy strenuous activity. Of course, you're going to assess for signs and symptoms of infection, any kind of hemorrhaging, and graft rejection is what's going to happen when they do the transplant, if it's not going to take. And so that will start with a lot of inflammation and a cloudy appearance, so patients are taught to really watch for that. And this is just a little picture that shows a little bit about the corneal transplantation. Eye donation, just to know, we'll talk about this when we do organ donation, but corneal tissues can come from donors. Donors have to be free of infectious disease or cancer at the time of death, and you have to do anybody who's a potential eye donor at death, these are the things that have to be done, and you would get orders related to that from the organ procurement agency if someone was going to be a donor. Cataracts, many of you have seen patients with cataracts. They'll have a cloudy look to their eye surface and really a blurring of their lens. This opacity makes it difficult to see when you're trying to look in the eye to look at the retina. And on like manner, it makes it very difficult for the patient to see. Their visual acuity is really restricted. They don't have pain or really eye redness. It's just this patchy look. And it really distorts the way that the vision can process the information. So cataract surgery is the main thing that is done. Sound waves are used in a suctioning probe, and the sound waves break up the lens and the pieces are sucked out, and the capsule remains pretty much intact. Post-operative care, antibiotics are given subconjunctively. Eyes unpatched. Discharge usually occurs within an hour. So people do go home very quickly. Dark glasses are required to be worn to protect the eye. They'll have antibiotic and steroid type eye drops. So, some mild itching is somewhat normal. If they begin to have pain, you need to make sure they are aware that really does mean a potential complication is coming on, and they need to call the doctor right away. Again, measures like we talked about to reduce intraocular pressure, and then prevention of infection, and just kind of assessing the area daily for any bleeding or signs of infection. These are just some health teachings that reiterate some of the same things that we just discussed. And you really want to go over the procedure for how to use eye drops. Glaucoma is another disease of the eye. It's caused by increased ocular pressure, and what happens is the retinal blood flow and the nerve fibers become ischemic. You will see cupping and atrophy of the optic disc. Peripheral vision is lost first in the beginning, and sometimes this goes on for quite a while unnoticed. These are some of the symptoms that you would have when it gets really more severe, and there are two different types of glaucoma that can occur. These are some of the diagnostic tests. Revert to the drugs that are listed here. Surgery is usually what's done when drugs fail. and that's just really to improve the flow